It feels like I'm having more better days,
Okay.
which is good. So, but I can tell when it's going, if I get on, especially when I'm crunched on the bike.
Yeah.
Or I was on the rowing machine the other day too. Same thing. Blew up on the bike, blew up on the rowing machine when I'm compressing here, which is probably pushing on that diaphragm.
So that's strong. Now bring your head all the way back. That's strong. Tuck your chin down. Yeah, so here we can see how the neck is affecting your lower leg, your rectus muscles, your thighs. Lift up. So like if you're on a cycling position or if you're looking down crunched over, how all these muscles relate, and your neck, a neck issue can cause a pelvic issue or a knee issue.
Or if I'm rowing.
Yeah, now bring your head back, lift up.
Oh, interesting.
Right.
Because that rectus goes and then I can't breathe, right?
Yep, and again, there it goes. So stay there, now lift. Applied kinesiology is, in my opinion, the most advanced and specific type of biofeedback evaluation that anybody can perform on another individual. We're evaluating that through your nervous system, through the muscle test, and we're getting a real-time biofeedback evaluation of that function.
Having a healthy functioning nervous system is going to impact so many aspects of your health. And with AK, we're addressing the musculoskeletal structural system, biochemical, so like nutritional side of things, and then the emotional side of things as well. Addressing all three of those aspects with AK can address such a wide variety of symptoms, which is why you see such a wide range of patients in a AK clinic.
It all started with my daughter. She has autism. Probably around a year, we knew something wasn't right. We went to the pediatrician. He's like, is she talking? Is she starting to, babble? And I was like, no, she's not. And he said, well, keep an eye on it. We went and saw so many specialists, but no results. So at a year and a half later, she still can't talk. She didn't walk well. She lost her balance. At that point, I was desperate. I didn't know if my daughter was ever going to talk. And I took her to Dr. Gangemi, and she had a gluten issue, a dairy issue. She had yeast overgrowth in her intestines. So we took her all of that immediately. Within a week, she started talking. Her speech therapist was there, and she said, that's not me. She said, that's the diet you have her on. You continue.
Here's your large intestine. So you can see, let's touch right here. That's the reflex for your large intestine. See how weak that goes? Mm-hmm. So that means that's the relationship between your gut affecting your pelvis. So if you got dairy, that's gonna make your pelvis more unstable because it affects your tensor fascial latus, your IT bands here. So then, even though you got injured from the fall, not healing as well can sometimes be related to even like what compromised the muscles, in that case, the dairy, I've taken the basis of applied kinesiology and a lot of our foundational aspects of AK to develop systems healthcare, which is understanding the hierarchy of systems and how there should be an order to how things are to be treated in your body. So the results are holding longer than what they might have otherwise because you're figuring out the hierarchy of what should be corrected in a systematic order. It actually might be, this is an acupressure point. So look, when I push here on your hip, pull hard. Yeah, that shuts the muscle off, it weakens the muscle. I tap there, no change. There, that strengthens. So this is an acupressure point related to the muscle that you're feeling injured on the right hand side. Tapping a point on the head, the face in this instance, and I'm pushing on the area where you're having an issue, and it helps to relieve the pain and settle down some inflammation.
I've been coming to see him probably about 20 years, and I mainly came here for thyroid issues and being tired or not. My thyroid medicine was just, the doctor could never get it really adjusted, and so he started treating me for thyroid, and it was really an experience because I was able to really get off thyroid medicine, and I can just now naturally with some supplements, and I come here and he works with me if it should get off, and it just has helped a lot.
We can do a real-time treatment, of course, whether that be chiropractic adjustments or acupressure, acupuncture points, or craniosacral therapies, or viscerosomatic reflexes, like specific organ reflexes. Obviously, nutrition, exercise, dietary changes, lifestyle changes, and all these things to help facilitate the person's health. All right, arms.
Arms are pretty good.
So pulling is good, like the shoulder forearm thing.
Yeah, there's been some times like, yeah, for the most part, like I said, about 2 weeks ago, my body just was like, good. My back started feeling better. Yeah, I was about 97, and I was just a pre-elite athlete, rowing, primarily sculling. And in 2003, I decided, you only live once. I'm gonna try to make the national team and go to the Olympics. And you know, rowing's a full body, full range of motion sport where you're driving with your legs and you're pulling in with your arms. So I would have these intercostal injuries, and some of them were pretty severe. Like I would jump in my car and drive up to see Gangemi where I couldn't move my left arm. I'd walk into his office in pain. I would walk out of his office and I could move again. Now I knew there were still like weaknesses, but within 24 to 48 hours, I was back on the water rowing again. He was able to put me back at peak training performance. Went to the World Championships in 2003, 2004. And I really credit Dr. Gangemi for being able to keep me training and in top physical condition. Yeah.
I'm a chiropractor. A lot of applied kinesiologists in the U.S. are chiropractors, but you can adjust the spine. You can adjust, even a joint in your body just by really adjusting the tension or releasing the tension of the muscle that is causing that bone to be out of place. And you can do that through acupressure points. You can do that through trigger points. You can do that through, the reflexes. You can even do that through changing diet and nutrition.
Patients love it. They're always happy to be treated with AK. They're really happy to have someone that's going to treat them naturally and holistically. They want someone that is going to really figure out what specific nutrient do I need? Can you fix all these old injuries I've had, these concussions, brain fog, infertility that I've been struggling with for years? They want a different answer.
I used to play hockey up in Canada very competitively, and I got hit from behind in a game, and it gave me a very severe concussion. I was knocked unconscious for a while, and when I woke up and finally came back to, for the first 48 hours, I was okay, typical concussion signs, but then quickly I started developing a really bad speech impediment, had virtually no balance at all. I had to go through a lot to get back to walking and talking normally, and the headaches were just unbearable. And so my mom had heard about Dr. Gangemi, or maybe had seen him before, so I started coming here when I came home from Canada, and immediately came in and saw him. He muscle tested me, got me on some different supplements, and it was pretty remarkable how quickly after seeing him, my speech started to come back to normal. Prior to that, they had told my parents I'd probably always have a speech impediment, might always need some kind of assistance in different things, and I've pretty much kicked all of that, pretty much made a full recovery. So with my kids, we're getting them used to this at such an early age, because they can come in here, they can muscle test, they know what they're doing. It's not weird to them. And then if they have any issues, we talk about those with Dr. Gangemi, and then he treats them, and they typically go away.
See if you can do this one now. Hold your arm like that and push towards me. Amazing. And a lot of these techniques we can do right in our office, so we can then treat the area that we feel is compromised or needs more treatment, and we can see again the real-time biofeedback change in that muscle test to know if we are performing the right modality for that person or not, or if something else may work better. Two people may have the identical type of knee problem presenting in your office, but one person's knee may be compromised because they actually injured it and they need direct mechanical treatment to that injury, like muscle work or some type of local therapy, and somebody else, their knee may be bothering them because their endocrine system is compromised. So AK is so efficient and, in my opinion, the best way to identify and treat that.
And I wouldn't want to practice without AK. I wouldn't want to practice without muscle testing. I can confirm my findings with muscle testing. I can get into deeper things that I wouldn't be able to do otherwise. We're able to get deeper and figure out what's actually going on and provide a different solution.